Welcome to an exciting exploration of the hidden gems in healthcare and pharmaceutical industry. We'll unveil lesser-known healthcare careers that play pivotal roles in improving patient care. Join us for a diverse panel conversation featuring experts from various backgrounds, and we'll discover how diversity enhances healthcare, leading to smarter solutions, greater access, as well as we'll gain insights from our panelists' unique career journeys and experiences. Get ready to explore the partnerships that drive innovation in healthcare, making the world a healthier place.
Hi, I'm Mike. I'm a supervisor of operations of the early pick shift at McKesson Canada, located in Moncton, New Brunswick.
Hi everyone, I'm Dina Gayet. I'm pharmacy practice lead at Rexall, and I'm located right now in the office of Meadowville, Mississauga.
Hi everyone, my name is Alexis. I'm the designated manager at the McKesson Specialty Pharmacy located in Ontario, currently at the airport campus.
And so excited to get your expertise and stories today on the topic. And so our first question I'd like to ask is, can you share your personal career journey and how you discovered your passion in the healthcare and pharmaceutical industry?
So for myself, my career journey in the healthcare and pharmaceutical industry have started, and it all began for me being raised up in a household where basically healthcare and science was the profession of my parents. My dad was a physics teacher and my mom was a physician, so we were kind of interested in these kind of topics. I found myself coming more passionate about science and biology and pharmaceuticals. And eventually I pursued a degree in pharmacy. It was during that time when I got to be introduced to a whole world of pharmaceutical care and healthcare. And the more I actually dived into it, the more I found that it's a great potential for this field, for innovation and how it's very impactful on patient lives. So that what started the whole journey after that, and after completing my degree. Took several internships in pharmaceutical companies as well as retail. And over the years, my career have been taking me to various roles within the healthcare and pharmaceutical industry. Each role honestly have represented its own set of challenges for me. It was own set of opportunities, but overall it was very much solidifying my passion towards that career and how it can be very impactful on people's life by creating more healthcare to our society.
So after school, I was sort of at a loss, not sure what direction to go. Did some college, didn't pan out, and I was stuck at sort of a wall, I was stuck at a standstill. So I went to a placement agency and I actually got a job into a facility like this one. Now I've been here for 2 years and I've already risen up to a supervisor of the early pick shift. So yeah, it's going good and it's advancing well here. There's plenty of opportunities here. So
when I was younger, I had to go to the ER with my grandparents a few times and had to go through that wait. This integration, I think, is kind of important in our healthcare community. So because of that, I felt like there was a big need for this role in our healthcare system. And I applied to pharmacy school at U of T. So after I graduated, I started my career as a community pharmacist inside a doctor's clinic. And ever since then, I've been working on kind of expanding my experiences in the pharmacy industry. So now as the designated manager of the specialty pharmacy at McKesson, our pharmacy kind of focuses on a comprehensive and coordinated model of care for patients who are diagnosed with, chronic illnesses and really complex medical conditions, and kind of offering them the same ease of access a community pharmacy can provide for these patients, which I think is actually very important in our healthcare.
So thank you for sharing those personal journeys. I'm just reflecting on your stories and seeing like the 180 and your experience, and first being young and figuring out what you want to do and getting into that career and seeing how your work firsthand positively impacts the lives of everyone. So how has diversity played a role in your career path, and how do you see it positively impacting patient care or care in general in the healthcare sector?
You really need to have diverse clinical trial populations for you to ensure that the medication and the treatments is effective and is good for a wide range of patients. You can also see it when you're doing innovations in any new technology in the research and development. You really need to have a diverse team, which meaning that you're probably getting a lot of wide range of backgrounds, experiences, and perspectives. So you kind of foster all these innovations by encouraging the diversity in that sense. Um, Also, I see it on daily basis on the day-to-day practice where there is a better communication when you have a diverse team. They can bridge the language and the communication barriers that may exist between healthcare professionals and the patients who have different backgrounds and preferences.
For me, diversity just means bringing everyone in and everyone's perspective into the conversation. And it seems like we get better results across, for me, is for just on the warehouse level, but you get a lot better results with the diverse opinions and being able to sit there and tactfully get to the best outcome.
Diversity for myself, I think, actually really helped boosted my career and brought me some personal satisfaction. I believe I'm now in a position of leadership in the McKesson specialty pharmacy. And one of the reasons I was able to get to this stage is due to really all the role models that I see around me. So there are many individuals of different races, ethnicity, gender, sexual orientation in positions of leadership at McKesson, as well as in the pharmacy itself. And this work environment kind of makes me feel that my cultural and ethnic background is really an advantage that should be respected, if not celebrated. And in the healthcare sector itself, I believe diversity creates a stronger feeling of, inclusion and community for healthcare workers, which makes the workplace feel safer and more enjoyable for staff. This also helps ensure that, on the patient end, no matter really who walks through the door, there is someone in the staff that can kind of identify with them, communicate with them, and better serve their individual needs.
So from your experience, what are some of the more lesser known but rewarding career opportunities in the healthcare pharmaceutical industry?
Some of the obvious paths are kind of the big titles that you can see there that you can actually face from a public perspective. But what I'm seeing even from my career, I would call them like the hidden soldiers, where they actually complete the cycle. Without them, the cycle won't be complete. And they are an integral part of the health system. Some of them right now, and it's very important, is the healthcare translators and interpreters. Like in Rexel now we introduced an app called Voice, where you have a live translator that comes live to your app if you have any customer or patient that coming with a different language which you speak, or there is a communication gap over there, where they are live. They take what you say and they translate it, they bridge the barriers, and it makes the communication very clear and efficient. This is one of the things that I think one of the paths that is not very well known, but to today's innovation, like it's very crucial. I think one of the other stuff is the healthcare data analysis. I know that we don't talk much about them, but the data that we actually grab and gather and base our decisions or observations need an analyst behind the computer that kind of analyzes all these data. And these people are the ones that compile everything for us and makes it easy after long hours of analysis. They come with one page that I can look and see, okay, now this is the results. So these are also, I think it's very rewarding career opportunities when it comes to that, because overall they improve the healthcare processes as well. So these are the two examples that I can think of.
For my position in the warehouse, there's a warehouse, approximately 100 employees in the warehouse. You have people in all kinds of different sections in the warehouse, if you will, in OTC, RX, what have you, in picking. You have a whole team putting the product away from the receiving doors. And then from there, you have lead hands leading those teams, supervisors also backing those lead hands, and all the way up to the director of operations here at the warehouse.
But I do feel like being a pharmacist is not something that is very widely advertised to the general public. And I think it is a very rewarding career opportunity in healthcare. I think, in general, people don't really have a very clear idea of what a pharmacist does. And, people kind of think, oh, it's limited to putting a label on a bottle and then giving a medication out to a patient upon the doctor's request. But actually, all pharmacists are really responsible for assessing the doctor's prescription. They're looking for the indication, they're looking for drug interactions, the dosage. So really that last line to catch any errors that that might cause harm to patients.
I think as we've emerged out of what we know or of the pandemic, the strain on the healthcare system has brought about, pharmacists being those, hidden soldiers that have come out to the light. I'm going to use the word that you shared, Dina, and have been really helpful in being able to, go to a pharmacy to get prescriptions. I know has really positively impacted a lot of my peers. So I'm glad you shared that point. And continuing on the trend that just sticks out to me, Dina, so I'm gonna use it a lot more. The hidden soldiers piece. My next question is, could you elaborate on the essential connections and partnerships between key players in the healthcare sector that have made significant impact in improving access and creating a world of better health?
The healthcare sector I considered it one of the most complex system in our society when it comes to compromising a lot of key players, and the partnership and the overlapping between these parties are essential and crucial for this system to move smoothly. So one of the big partnerships that comes to my mind is the healthcare providers and the insurance companies. The partnership between the providers, which would be a hospital, clinic, pharmacy, and the insurance companies, is vital for ensuring that the patient can access their medical care in an affordable way. They manage the cost, the financial security of the patients, and such. So I think this is one of the main partnerships. The other one is, I would think, is the pharmaceutical companies and the research institutions, where the collaboration between the two is essential, that can lead to the discoveries and the developments of new medications and therapies, and how this partnership can really accelerate the translation of a clinical research in a lab, into a practical treatment that comes to the patients. I would think also one of the collaborations is the academic institutions and the healthcare providers, where in my own career, when I was at school, I did the internships and I rotated, and where the school collaborated with all the providers on the ground to help nourish the education experience for their students. So these kind of collaboration also is very essential for me.
One of the key connections that I believe make a significant impact is actually the relationship between, our Enviva infusion clinics and pharmacies. So Enviva clinics can infuse patients in a community setting, which takes away from the strain placed on our healthcare system in the hospitals. As well, in these clinics, patients can receive their treatment at a more convenient, comfortable, and familiar settings. They're going back to the same clinics, at a regular basis. And since most of these infusion medications used in the clinics are dispensed from, specialty pharmacies, our Enviva and specialty pharmacy team at McKesson, we work very closely together, but kind of help provide that seamless experience for patients where they can kind of have that one-stop shop for their infusion needs.
I kind of want to bring it back to our audience. We have young people who are tuning in from schools, homes, or workplaces across the country, in this, tested career exploration time. It's like, hey, what am I going to do? What am I going to do in the future? Thank you, Take Our Kids to Work Day, for providing this opportunity to hear from these experts. And so I want to ask you, as an expert in your field, what advice would you give to young individuals aspiring to pursue a career in the healthcare or pharmaceutical industry?
So I would say that if you're seeking a career in the healthcare industry, you have a really wide range of opportunities. Like there is a lot of diverse career paths that you can actually make a meaningful impact on people's lives. First, you need to understand your motivation. Reflect on why you want to pursue that career and make it your genuine passion to help others, and then it will be the fuel that will push you towards success. Explore different paths, and ask peers and research and do your own diligence of checking what's over there. Once you kind of feel you're interested in one thing, pursue the education and the training to like dive more into that specialty, whether it's a school or a course or a diploma or whatever it is, but just go and build on it with a practical experience, like volunteer in these areas and facilities to make sure that you actually pick the right choice. Always stay informed because these sectors are always adapting, they're always evolving.
So for me, again, it's taking initiative, including yourself in anything that you can. Uh, Whenever the opportunity comes, that you can make yourself present and make a difference. Just make a, just join the team. Um, be curious, ask questions, reach out for feedback.
I think my one specific advice for young individuals is to please place yourself in situations where you can kind of have exposure to different workplaces. If you have a passion for healthcare and pharmaceutical industries, please do your best to talk to all aspects of the career, including ones that might not be as obvious and you might not be as interested in. You know, if you focus solely on your grades, you might not be able to get the diverse experience that can kind of give you a more realistic idea of what each role pertains. And sometimes, the role you think you want might not actually be what you actually want to do. So it's very important to network and talk to different people in the industry. And as a student, you're actually in a very great place to do so. So please take advantage of it.
Thank you, thank you. And just to, go a little bit more further than what, students are hearing. A lot of students, studying right now or in school, the big theme is technology. They're thinking about AI, they're thinking about coding. Should I just go to school to become a software engineer? That's the thing that I'm being told is, the future and tech, it's more tech. So the question I have to continue this conversation on advice is, how do you see technology and innovation shaping the future of healthcare, of the healthcare sector? And what are opportunities do they offer for, career growth and development?
So, to your point, lately, especially lately, these kind of technology and innovation have offered a significant opportunity for the career growth and the development for individual actually interested in pursuing these kind of careers. You can see it in the telemedicine and the remote care, where there are monitoring technologies, expanding access to healthcare services. Um, and the career in the telehealth involves like role like the telemedicine physicians or telehealth nurses and the moderators to these kind of platforms. One of the other things we're seeing right now is the wearable devices and the remote monitoring for our patients, where these tools and the equipments that we give our individuals are actually moderated by engineers, where the careers in this field is very wide. Others are like you can see the robotics in our warehouses and central fill locations, where the robot is kind of doing a lot of filling and preparing the blisters and everything. So maintaining these kind of um, equipments are one of the big things.
At the warehouse level, yeah, you're right. There's robotics. I was fortunate to meet a couple supervisors from Edmonton, where they had recently gone 100% automated. So they have something called A-frame technology that can pick. It's could be a team of 50 people, or you could have a robot picking the same amount of lines per hour. So we're all getting there. Here in Moncton, we're not there yet, but I'm sure it'll be coming soon.
I believe, technology and innovation will definitely play a very big part in the future of healthcare. AI has the potential to really kind of redesign healthcare and improve patient care. I personally also have had some experiences in central fill pharmacies where they kind of use robots to pack blister packs for the patients, and technology that also allows pharmacists to even check these blister packs from the comfort of their own home using photos provided by the robots, which kind of really improves on the convenience for our staff. As well, artificial intelligence can be used to kind of assist in producing complex compounded medications where they kind of film, the medication being created by our registered technicians, and just based on the video alone, they can kind of assess the accuracy of the product. Because of things like this happening all along the healthcare network, I believe health career path that really combines the two, such as medical engineering, will become more and more important in the future.
So I'm a student that's, I'm very, business minded, finances, I excited about sales. I have an extroverted personality. Where in the healthcare industry would I best fit in? What are some roles that I think best fit in?
So I would say that you go to the marketing team where you kind of and even the sales team too, because you're that kind of character. You're outgoing. You want to speak to people, collect some information, and also on the other side, you kind of have this business aspect where we can utilize that and build on it. Where how to grow, how to make a business case, where is the opportunities for growth here from a corporate perspective, whether it's pharmaceutical companies or retailers, or maybe a small setting like a community pharmacy kind of. So these are all areas where you can develop and grow.
Thank you for sharing that. Yes, the marketing, branch and the more corporate roles is there's definitely a place for folks that are more extroverted, to make the sales and so forth. We have our last question that I'm hoping to get your insight on, and really appreciate all the thoughts and insights that were shared with us today on how we could, how we are advancing diversity in healthcare through, that diverse representation in the healthcare industry, but also the diversity of the different roles and how folks can access opportunities within the healthcare industries, in turn, making healthcare more accessible to patients throughout the country. And so our last question is, can you share an example of a project or initiative in your career that exemplifies the positive impact on diversity and collaboration in improving the industry's overall performance and patient outcomes?
For me, I can't think of a better example than in the past 2 years during the pandemic. We've done an offsite vaccination clinics, and we've gone outside of our pharmacy, outside of our comfort zone. And we went to facilities like senior homes and retirement homes where we kind of did the vaccination on site for ease of access for these communities. And these kind of events weren't to be successful without the collaboration of so many team players in this initiative, where the key components were the pharmacists and the pharmacy technicians that were inside administering the vaccination, managing the logistics of the vaccination, and providing education to the seniors and their families. Also the home operators, like the senior home operators, where the home managers or the secretaries were kind of involved in how to organize the event, coordinating all the efforts between the facility and the pharmacy providers. Also, we've been collaborating where they're physicians as well, where they're local family doctors We're identifying who's the high-risk patients, getting letters for them to be the first in line to get the vaccines in their arms. And also the public health units, where we kind of collaborated with them as well, and all the people that works in the public health unit that provided guidance, provided allocation to the doses to make sure that these doses reach the people in need. So all these kind of collaboration worked pretty well and seamlessly to help support these kind of events. So it was a great example of how different teams, different fronts can come together and team up together to provide these kind of great outcome for the public. And it came in a time where the community were so much in need for all of us to step up.
And for us, it was due to the pandemic when the vaccines just came out. We had no systems in place to hold or anything to do with these vaccines, and we just had to get on the horse and go. So, and everyone worked together. We got them out seamlessly with no errors.
So I just want to thank you in general, everyone, for the pandemic moment. I think we just need to take a moment to thank, our healthcare professionals across, and by having the three of you here and in all your roles, just to share that, gratitude for being on the front line and really looking out for Canadians. And so I just want to take that moment to thank, as you were sharing your stories. Thank you for participating in this panel. It's been a great discussion. I certainly learned a lot, and I'm looking forward to the students who are watching this to take some of these gems and apply it to their own life. Our journey through the healthcare industry's hidden careers has been enlightening. Diversity isn't just a buzzword, it's a catalyst for better healthcare. Remember, the healthcare field offers diverse roles beyond what meets the eye. Thanks to McKesson Canada for their century-long partnership in advancing healthcare. Continue to explore the world of healthcare and consider the impact you can make. Let's work together to create a healthier future for all.